There is a conversation that every man over the age of 60 deserves to hear, yet most men never truly have it. Not in a doctor's office, not during conversations with friends, and not even in those quiet moments at night when questions and worries begin to appear. It is a conversation about something deeply connected to a man's comfort, confidence, and quality of life: prostate health. Because the truth is, the small choices you make every single day can shape what your future looks like. They can influence whether you sleep peacefully through the night or wake up repeatedly needing to use the bathroom. They can determine whether you continue enjoying travel, hobbies, and time with your loved ones, or whether your daily routine slowly starts revolving around your bladder. I'm Dr. Rose. I'm a urologist with years of clinical experience helping men understand their prostate, manage symptoms, and take better control of their health. And today, I want to share 5 simple, natural habits that every man can begin using after the age of 60 to support better prostate function. These are not complicated medical procedures. They are not expensive solutions. They are daily actions that are realistic, accessible, and supported by science. And I want to tell you something right from the beginning. One of these habits surprises many men because they never imagined something so simple could have such a meaningful impact on prostate health. Before we begin, if you believe men's health conversations like this are important, take a moment to support this message. Press the like button, share your thoughts in the comments, and subscribe so more men can discover information that may help them protect their health. And stay with me until the end, because I will not only explain these 5 habits, but I will also give you a simple plan you can begin following right away. Now, let's talk about something I hear from many of my patients. A lot of men believe that problems like weak urine flow, difficulty starting urination, waking up several times at night, or feeling like they cannot fully empty their bladder are simply unavoidable parts of aging. But that is not the complete truth. Yes, the prostate naturally changes as men get older. One of the most common changes is a condition called benign prostatic hyperplasia, or BPH. This means the prostate becomes enlarged over time. By the age of 60, many men already show signs of prostate enlargement, and as men move into their 70s and beyond, the number becomes even higher. But here is the important point. An enlarged prostate does not automatically mean you have to accept discomfort, frustration, or a lower quality of life. Modern research continues to show that daily habits can influence how your prostate functions. The choices you make with your hydration, movement, nutrition, sleep, and overall lifestyle can help reduce symptoms and support long-term prostate health. Growing older is a natural process, but spending every night interrupted by bathroom trips, avoiding long journeys because you are worried about finding a restroom, or organizing your entire day around urinary problems is not something you simply have to accept. During my years of working with men, I have met many patients who believed their best years were already behind them. Some felt embarrassed, some felt frustrated, some even believed there was nothing they could do. But I have also seen many of these same men regain confidence and improve their daily lives by making small but consistent changes. Not because of a miracle solution, not because of a single magic treatment, but because they understood how powerful daily habits can be. So I want you to think of this conversation differently. Imagine we are sitting together in my clinic, having a private discussion about your health. This is the same advice I would give you if you were sitting across from me asking, "Doctor, what can I actually do every day to protect my prostate?" So let's begin with the first habit. The first habit is strategic hydration. And I want you to remember this phrase: drink smarter, not simply more. Many men misunderstand the relationship between water and prostate health. They spend most of the morning drinking almost nothing. They take only a few sips during the day. Then, in the evening, they suddenly drink large amounts of water, sometimes right before going to bed. And then they wonder why they wake up 3, 4, or even 5 times during the night. The problem is not always the amount of water you drink. The timing matters. As men age, the body's thirst signals can become weaker. You may not feel thirsty even when your body needs more fluids. At the same time, the bladder and prostate tissues can become more sensitive. When your urine becomes highly concentrated because you are not drinking enough during the day, it can irritate the bladder lining. This irritation can contribute to feelings of urgency, discomfort, and more frequent trips to the bathroom. Strategic hydration works differently. Instead of drinking a large amount late in the evening, the goal is to drink consistently throughout the morning and afternoon when your body is active. This allows your kidneys to process fluids properly and helps your body maintain better balance. Then, as bedtime approaches, you gradually reduce your intake. You are not dehydrating yourself. You are simply giving your body enough time to manage those fluids before you sleep. Research in urology has shown that adjusting fluid timing can significantly improve nighttime urinary symptoms in older men. Think about how powerful that is. A simple change in when you drink water can improve your sleep, protect your comfort, and help you feel more in control of your daily life. So tomorrow morning, try something simple. Start your day with a glass of water. Continue drinking small amounts regularly throughout the day. And in the evening, only drink what you truly need. Your prostate does not just depend on medications or treatments. It also responds to the choices you repeat every day. Now let's move to the second habit, and this is something that many men underestimate. The second habit is a simple light walk after meals. You may have heard many times that walking is good for your heart, and that is absolutely true. But what many men do not realize is that walking also plays an important role in supporting prostate health. Your body depends on healthy circulation. Blood carries oxygen, nutrients, and important signals throughout your entire system. And your prostate is no different. When blood flow is poor, tissues do not receive the same level of support they need to function properly. This is especially important as men age. Many men spend a large part of their day sitting. They sit after breakfast. They sit while watching television. They sit after meals. And over time, this lack of movement can contribute to slower circulation, increased inflammation, and reduced metabolic health. After a large meal, blood sugar levels naturally rise as your body begins processing the food you have eaten. But when you sit for long periods afterward, your body does not use that energy efficiently. Inflammation levels can increase, circulation can become less effective, and the pelvic region, including the prostate, may not receive the support it needs. This is where a simple walk can make a meaningful difference. A 10 to 15-minute walk after lunch or dinner can activate your muscles, improve blood flow, and help your entire body function better. When you move after eating, oxygen and nutrients circulate more effectively. The muscles involved in bladder control remain stronger, and your body becomes better equipped to manage inflammation. Some studies have found that older men who maintain regular walking habits have a lower risk of developing more serious urinary symptoms related to prostate enlargement. But beyond the science, there is something else I want you to think about. A short walk after dinner is not only about your prostate. It represents independence. It represents freedom. It means being able to go outside with your spouse, spend time with your grandchildren, walk your dog, or simply enjoy the evening air without constantly worrying about your bladder. Many men do not realize how much urinary symptoms affect their confidence until they begin taking control again. A simple habit like walking can become a reminder that your body is still capable of improvement. And the best part is that this habit does not require expensive equipment. You do not need a gym membership. You do not need a treadmill. You do not need a perfect environment. If the weather is comfortable, walk outside. If you are at home, walk around your house. Even a few minutes of movement after a meal is better than remaining completely inactive. Remember this: circulation is one of your body's natural medicines, and unlike many medicines, movement is something you can access every single day. Now let's talk about the third habit. This is a topic many men avoid discussing, especially as they get older. But as a doctor, I believe important health conversations should never be surrounded by embarrassment or shame. The third habit is maintaining healthy sexual activity. For many men, this subject becomes uncomfortable. But when we talk about prostate health, we need to understand how the body works. The prostate is not just a gland that causes problems later in life. It is an active part of the male reproductive system. The prostate produces fluid that plays a role in semen. And like many parts of the body, it benefits from healthy function and regular activity. Ejaculation helps empty prostate secretions. Some researchers believe that regular ejaculation may help remove accumulated fluids and cellular waste from the prostate. Think of it as one of the body's natural maintenance processes. Several studies have explored the relationship between ejaculation frequency and prostate health. One large study involving thousands of men over many years found an association between more frequent ejaculation and a lower risk of developing prostate cancer. However, it is important to understand that many factors influence prostate cancer risk. Age, genetics, lifestyle, diet, exercise, and overall health all play a role. Sexual activity alone is not a guarantee of preventing disease, but maintaining a healthy, intimate life can be part of an overall approach to men's wellness. There is also another important side of this conversation. Sexual health is not only about biology, it is also connected to emotional health. Intimacy can help men feel connected, confident, and emotionally balanced. Many older men quietly struggle with changes in sexual function. They may feel embarrassed. They may believe it is something they should simply accept. But these changes are common, and many can be addressed with proper medical guidance. Difficulty with erections, changes in desire, or concerns about sexual performance are issues that doctors discuss every day. You do not have to ignore these concerns. You do not have to suffer silently. There are safe and effective options available for many men. The mistake many men make is waiting too long before asking for help. Ignoring a problem does not make it disappear. Having an honest conversation with your doctor gives you more choices and allows you to take action earlier. Your health is not only about preventing disease, it is also about maintaining confidence, connection, and quality of life. Now let's move to the fourth habit. This one is something you practice every single day, often without even thinking about it. It is your food. The fourth habit is strategic eating, using food as a form of preventive support for your prostate. Every day, you make choices about what enters your body. The question is simple. Are your meals supporting your prostate, or are they creating more stress for your body? Many men think nutrition is only about weight. But food affects much more than your appearance. The nutrients you consume influence inflammation, hormone balance, cellular health, and the way your body repairs itself. Certain foods contain compounds that may support prostate function. One important example is lycopene. Lycopene is the natural red pigment found in foods like tomatoes, watermelon, and guava. This powerful antioxidant helps protect cells from oxidative stress. Research has suggested that men who regularly consume cooked tomato products may have a lower risk of prostate problems. Cooking tomatoes actually increases the availability of lycopene, allowing your body to absorb it more effectively. Another important nutrient is zinc. Zinc plays a role in maintaining healthy hormone balance and supporting normal prostate tissue. Foods such as pumpkin seeds, nuts, and seafood can provide this essential mineral. Then there are cruciferous vegetables such as broccoli, cabbage, and cauliflower. These vegetables contain compounds that support the body's natural detoxification systems and help maintain healthy cellular function. The goal is not perfection. The goal is consistency. You do not need to completely change your life overnight. You simply need to make better choices more often. Add cooked tomatoes to your meals several times a week. Keep a small portion of pumpkin seeds or nuts available as a healthy snack. Fill a significant portion of your plate with colorful vegetables. Choose quality protein sources like fish, chicken, eggs, and beans. This is not about following an extreme diet. It is about giving your body the materials it needs to continue serving you well for many years. Food is something you control, and every meal is another opportunity to support your health. Now let's talk about the fifth habit, because this is one that many men underestimate until they experience the difference themselves. The fifth habit is deep, restorative sleep. Sleep is not simply a time when your body shuts down. It is a period when your body repairs, restores, and prepares itself for the next day. And for men over the age of 60, quality sleep becomes one of the most important foundations of overall health, including prostate health. I often ask my patients a simple question: when was the last time you woke up and truly felt refreshed? For many men, the answer is difficult. They wake up tired. They wake up several times during the night. They feel like they slept, but their body never fully recovered. Many men assume that poor sleep is just another unavoidable part of getting older, but that is not true. While sleep patterns can change with age, constantly experiencing poor sleep is not something you should simply accept. Deep sleep plays a powerful role in regulating the body. During the deepest stages of sleep, your body produces important hormones and chemicals that support repair and recovery. Melatonin, for example, helps regulate your sleep cycle and has protective effects throughout the body. Growth hormone, which is released during deep sleep, supports tissue repair and healthy function. When your sleep is constantly interrupted, these important processes can become disrupted. Poor sleep can increase inflammation. It can affect hormone balance. It can reduce energy levels. And over time, these changes may negatively influence many areas of health. For men, one important concern is testosterone. Sleep plays a major role in maintaining healthy testosterone levels. When sleep quality decreases, testosterone levels may also decline, which can affect energy, mood, muscle strength, and overall well-being. Research following thousands of men over many years has found connections between poor sleep patterns and increased health risks. This reminds us that sleep should not be treated as a luxury. It is part of your body's maintenance system. Think about your car. You would never expect a vehicle to run perfectly if you ignored maintenance for years. The human body works the same way. Your body needs recovery. Your organs need rest. Your immune system needs time to restore balance. And your prostate benefits from a body environment where inflammation is controlled and hormones are balanced. There is also an emotional side to sleep that many people overlook. When you do not sleep well, it affects your patience. It affects your mood. It affects your confidence. You may feel less motivated. You may feel older than you actually are. But when you begin sleeping better, something changes. You wake up with more energy. You feel more present. You regain a sense of control over your day. That is why protecting your sleep is one of the best decisions you can make for your long-term health. So practically, what can you do? Start with simple changes. Make your bedroom a place designed for sleep. Keep it dark. Keep it quiet. Keep it at a comfortable temperature. Try to maintain a consistent bedtime and wake-up schedule. Your body responds well to routine. Avoid spending long periods looking at bright screens right before bed because the light can interfere with your natural sleep signals. And remember what we discussed earlier about hydration. Do not drink large amounts of fluid right before sleeping. A full bladder can interrupt your sleep and create unnecessary nighttime bathroom trips. The goal is not just to spend more hours in bed. The goal is to achieve better quality sleep, because restorative sleep is one of the most powerful forms of protection you can give your body. Now, let's bring everything together. We have discussed 5 daily habits that can support prostate health after the age of 60. First, drink water strategically. Do not wait until you are extremely thirsty. Do not ignore hydration all day and then overload your body at night. Drink consistently during the day and reduce your intake before bedtime. Second, walk after meals. A simple 10 to 15-minute walk can improve circulation, support metabolism, and help your body manage inflammation. Third, Maintain a healthy, intimate life. Understand that sexual health is a normal part of men's health. Do not allow embarrassment or silence to prevent you from seeking guidance when needed. Fourth, eat with purpose. Choose foods that support your prostate. Include tomatoes, vegetables, nuts, seeds, and healthy sources of protein. Fifth, protect your sleep. Treat your nighttime routine as an important part of your health plan. These habits may seem simple, and that is exactly why many people overlook them. We often search for complicated answers. We look for expensive solutions. We wait for a major intervention. But many times, the strongest improvements begin with the small decisions we repeat every day. Now, I know some of you watching may be thinking, "Doctor, this sounds good, but I already have prostate symptoms. Is it too late for me?" And my answer is very clear. No, it is not too late. I have spoken with and treated many men who believed they had lost control of their health. Men in their 60s, men in their 70s, even men in their 80s, and many of them were able to improve their quality of life by making consistent changes and getting the right medical support. The goal is not to become young again. The goal is something much more realistic and meaningful. The goal is to preserve your independence, to sleep better, to travel without constant worry, to spend time with family without planning your entire day around bathroom locations, to feel confident in your own body. Your age does not define your ability to improve your health. Your daily choices matter. Every morning you wake up is another opportunity to take better care of yourself. You do not need to change everything at once. That is where many people fail. They try to completely transform their lifestyle overnight, become overwhelmed, and eventually stop. Instead, choose one habit. Just one. Practice it consistently for the next week. Then build from there. Small actions repeated over time create powerful results. Your prostate health is not determined by one single day. It is shaped by the patterns you create throughout your life. And the good news is that you can begin creating better patterns today. Your 60s, 70s, and even your 80s can still be years filled with strength, freedom, connection, and confidence. Aging is a natural process, but losing your independence is not something you have to accept without taking action. Your body deserves care, your health deserves attention, and your future self will benefit from the decisions you make today. Now, before we finish, I want to leave you with something practical. Information only becomes powerful when you turn it into action. Many men watch videos like this, they learn something valuable, they feel motivated for a few minutes, and then life continues as usual. But your health does not change because you know something. Your health changes because you consistently apply what you know. So I want to give you a simple action plan that you can begin immediately. Do not try to change your entire lifestyle in one day. That usually creates frustration. Instead, focus on building one small habit at a time. Start with the easiest step. For some men, that may be hydration. Tomorrow morning, before your coffee or breakfast, drink a glass of water. Make it a daily reminder that you are taking care of your body. Then continue drinking small amounts throughout the day instead of waiting until evening. For other men, the first step may be movement. After your next meal, instead of sitting down immediately, stand up and walk for 10 minutes. It does not have to be fast. It does not have to be exhausting. The goal is simply to tell your body that movement is still part of your daily life. If improving your nutrition is your focus, begin by adding one prostate-supportive food. Add tomatoes to a meal. Keep some pumpkin seeds nearby. Include more vegetables on your plate. Small changes are easier to maintain than extreme ones. And when a habit becomes normal, you can build on it. This is how lasting improvement happens. Not through perfection, through consistency. I also want to remind you of something important. While lifestyle habits can make a significant difference, they do not replace medical evaluation when symptoms appear. Many men delay seeing a urologist because they feel embarrassed. They tell themselves, It is just aging. I will deal with it later. It is probably nothing serious. But your health deserves attention. Changes in urination, blood in the urine, pain, sudden worsening symptoms, or major changes in your routine should always be discussed with a healthcare professional. Getting checked does not mean something is wrong. It means you are being responsible. The strongest men are not the ones who ignore problems. The strongest men are the ones who take action when something needs attention. A prostate examination or medical consultation is not something to fear. It is a tool that gives you knowledge, and knowledge allows you to make better decisions. I have seen too many men wait until symptoms become severe before asking for help. But earlier conversations often lead to better outcomes. Your health journey is not about fear. It is about awareness. It is about understanding your body. It is about making choices that allow you to continue living the life you enjoy. Because prostate health is not only about avoiding disease, it is about preserving your freedom. Think about the things that matter most to you. The ability to sleep through the night. The ability to take a long trip without constant worry. The ability to enjoy time with your family. The ability to stay active. The ability to feel confident. These things are deeply connected to your quality of life, and that is why this conversation matters. Many men spend years taking care of everyone else. They take care of their families. They work hard. They solve problems. They support the people around them. But when it comes to their own health, they often put themselves last. I want to remind you that your health matters too. Taking care of yourself is not selfish. It allows you to continue being present for the people you love. Your family does not only need you to be there, they need you to be healthy enough to enjoy the moments you share together. So if you remember only one thing from this conversation, remember this. Your prostate health is influenced by the choices you make every day. The glass of water you drink, the walk you take, the food you choose, the sleep you protect, the conversations you are willing to have. These decisions may seem small, but over months and years, small decisions become powerful results. You do not have to wait for a serious problem before you start caring for your body. The best time to support your health is before you are forced to. And if you already have symptoms, the best time to begin improving your habits is today. There is no perfect age to start. There is only the decision to start. I want every man watching this to understand something. Getting older does not mean becoming weaker. It does not mean giving up the activities you love. It does not mean accepting discomfort as your new normal. With the right knowledge and consistent habits, many men continue to live active, meaningful, and fulfilling lives well beyond their 60s. Your body may change with age. That is natural. But how you respond to those changes can influence your future. You still have choices. You still have control. And every healthy decision you make today is an investment in the years ahead. So now, as we come to the end of this conversation, I want you to take a moment and think about what we have discussed. Your prostate health is not something that should only become important when a problem appears. It is something worth protecting every single day. Many men spend years believing that discomfort, poor sleep, frequent bathroom trips, and changes in urinary function are simply the price of getting older. But your age does not mean you have to surrender your quality of life. There are choices you can make. There are habits you can build. And there are steps you can take to support your body and maintain your independence. Remember the 5 habits we discussed. Drink water strategically. Not by forcing excessive amounts, but by understanding the timing that works best for your body. Stay active after meals. A simple walk can support circulation, reduce inactivity, and remind your body that movement is still important. Maintain a healthy relationship with your sexual health. Do not let embarrassment prevent you from understanding your body or seeking help when needed. Choose foods that support your prostate. Every meal is an opportunity to provide your body with nutrients that help maintain healthy function and protect your sleep. Because a rested body is a stronger body. These habits may sound simple, But simple does not mean powerless. In medicine, some of the most effective changes often come from the things we repeat consistently. A single healthy choice may not seem significant today, but hundreds of healthy choices over time can completely change how you feel and function. I want you to imagine your life 6 months from now. Imagine waking up with more energy. Imagine feeling more confident. Imagine being able to enjoy activities without constantly thinking about your bladder. Imagine having more freedom in your daily routine. That future is not created by one dramatic decision. It is created by the small choices you make every day. And I want to address the men who are watching this and thinking, "Doctor, I have already ignored my health for years. Have I waited too long?" My answer is no. You have not missed your opportunity. I have met many men who believed they were beyond improvement. They thought their symptoms were simply something they had to live with. But after making better lifestyle choices, discussing their concerns openly, and receiving proper medical guidance, many of them experienced meaningful improvements. The human body has an incredible ability to respond when you give it the support it needs. Your body is not your enemy. It is communicating with you. Symptoms are not something to be ashamed of. They are signals. They are your body's way of saying, "Pay attention, take care of me." The mistake is not having symptoms. The mistake is ignoring them. That is why I encourage every man watching this to become more aware of his health. Do not wait until a small issue becomes a major one. Do not wait until discomfort changes your lifestyle. Take action while you still have the opportunity. And remember, prostate health is not only about preventing medical problems. It is about protecting the moments that make life meaningful. It is about being able to sit comfortably with your family. It is about enjoying vacations without anxiety. It is about sleeping peacefully. It is about maintaining confidence and dignity as you move through every stage of life. Aging is not a disease. Growing older is not something to fear. But caring for your body becomes even more important as time passes. The goal is not to fight aging. The goal is to age with strength, awareness, and confidence. So today, I want you to make a simple commitment. Choose one habit from this conversation. Only one. Do not worry about doing everything perfectly. Start with something realistic. Maybe tomorrow morning you drink more water at the right time. Maybe you take a short walk after dinner. Maybe you add healthier foods to your plate. Maybe you create a better sleep routine. Whatever you choose, commit to it. Because every positive change begins with a single decision, and that decision can happen today. Your health is not determined only by your past. It is also shaped by what you choose from this moment forward. Your 60s can still be a chapter of strength. Your 70s can still be a chapter of activity and connection. Your 80s can still be a chapter filled with purpose and enjoyment. Do not allow age to convince you that your best days are behind you. With knowledge, consistency, and the right support, you can continue protecting your health and living the life you value. If this conversation helped you, share it with another man who may need to hear it. It could be your father, your brother, a close friend, or someone who has been quietly struggling but never talked about it. Many men suffer in silence because they believe they are alone. But conversations like this remind us that health concerns are common and help is available. Thank you for spending this time with me. I am Dr. Rose, and my goal is to help men understand their bodies, protect their health, and make informed decisions. Never forget this. You are not powerless. Your prostate health is not controlled only by age or genetics. Your daily choices matter. The habits you build today can influence the quality of your tomorrow. Take care of yourself. Listen to your body. And remember, the best time to start protecting your health is not someday. It is today.